Friends, basically, there are four groups of surgeons. The freshers who are within 5 years of their qualification, like post-MS 5 years. There are young surgeons who are 10 to 15 years, maybe post-MS practicing orthopedic surgeons. There are matured surgeons who are almost more than 25 years into practice. And there are senior citizens who are at the, maybe fag end of their career. So for freshers, the robots, they are confused whether to adopt robots or not. They are here there to listen that how robots are helpful. Young surgeons, they are almost adopted. Most of them, they have adopted within 10 to 15 years of practice. There are certain matured surgeons who are still observing, and they still believe that their manual surgery is much better, or whether robot is going to make any difference in their practice. And of course, senior citizens, they have decided that a robot is not going to help them, and this is not their cup of tea. So me, among this third group of surgeons, still observing it, and hence, till now, I think it is not a marketing gimmick, and probably it will be helpful in my future endeavors in arthroplasty surgery. Now, the success of the knee replacement surgery, it depends on the correct indication, proper selection of the patient, surgical approach, accurate bony cuts and alignment, ligament balancing, implant design and size matching. Quality of the implants can make a difference. Good fixation with the bone with a good cementing technique. Patella tracking, control of the infection and pain management post-operatively. And out of all these, your navigation and robots only address the accurate bony cuts and alignment. None of the other issues are addressed by your robots. Let's go one by one. As you know that appropriate indication that you have to select a patient who has got pain at rest, pain at night, pain which hampers activities of daily living, and you see on the bone, on the X-ray, there is bone on weight-bearing X-ray, and Kellgren Lawrence 3, grade 3 and grade 4. So with a sufficient symptoms, with a proper X-ray, then you select this patient for surgery, and robot is not going to help you in this case. If you see surgical approach, you saw many live surgeries to the conventional approach and robotic approach. It's not a minimally invasive surgery, but rather, you learn this minimally invasive approach by way of evolution rather than by way of revolution, that directly from day one you put a small incision. Rather, the 4 to 6 extra pins which you are putting, these are additional injury to the bone, and that may lead to some complications in future. Now, ligament balancing, as you know, deformity cannot be corrected without releasing the contracted ligaments and balancing the collaterals. And it's the surgeon's feeling of balancing the ligament which help you on the table. As you heard today in the morning from Dr. Bikram Shah's lecture. And it is purely surgical skills that which ligaments you are going to release. Of course, now robot is not addressing the ligament balancing. It is more and more into the bone cuts rather than ligament balancing. Now, the implant design and size and quality of the implant, to get the best results, implant should be of size of the host knee, and different companies have got different sizes and different patency of the implants. And you must select an implant which is at least FDA, US FDA approved or CE certified, and have got at least more than 10 years of track record. And at present, robotics have a closed system and can use only one design of implants. And that is the one of the most important, disadvantage at present with all the robotic system. Everybody is not like Dr. Vaidya to have, the luxury of having multiple robots, so that you have a independence of using multiple, manufacturer implants. It is very expensive, and as a surgeon within a lifetime, probably you will have one robot in your armamentarium, so you'll have to do one category of implants. Fixation of the implant, better implant fixation in a saw cut bone, whether bore cut generates heat and devitalizes tissues, and how far the cement bone interface will sustain the future is questionable. Now, this is one of the aspects, patella tracking and resurfacing. As you know, that 20% of the TKR complications are due to maltracking of the patella, and resurfacing provides a better patient satisfaction. As of now, in 2023, many surgeons all over the world, they are little moving towards resurfacing the patella rather than not resurfacing, and neither robot nor your computer have developed the software to address this issue. It is only your surgical skills which is going to address this patella tracking. Infection control, here your Most common cause of revision of total knee replacement, 25% of the revisions are due to infection only. Your OT laminar flow, infection control, duration of the surgery, and of course the patient host factors plays an important role, and no role of robot in the control of infection. Here the technology doesn't protect us, your theater discipline and your meticulousness of surgery protects you. Pain management, critical for early mobilization, short stay, all this multimodal pain management you have to research, and there is no role of robot here for the pain management. Finally, we come to most important aspect of the accurate bony cuts and alignment. You have to take center, hip, knee, ankle, and it should be within 3 degrees of, outlier that your alignment, which age-old mechanical alignment has shown us very good outcome. Sub-millimeter correction may not be necessary. And whenever you see this kind of X-ray, though there is a tibial component is little invarus, but as long as you have balanced your knee properly, this is going to give you a good long-term outcome. In this kind of difficult cases where, bone is destroyed totally in this severe hemophilic in a young patient, 42 years, 7 years, shows a good functional outcome with a good restoration of the alignment without any, problem. So this satisfaction level that you will have in your manual balancing of the ligament. So the long-term results are same as conventional. We do not have enough of data now to prove that robotic has got a good long-term outcome. It is more invasive, extra pins are inserted and takes more surgical time and definitely more expensive. Whether these expenses can reach the poorest of the poor or greater population in our country, that is questionable. And one of the advantages of robots is a obese patient. This is a 130 kilo patient, 5 years follow-up of the bilateral total knee replacement, which was done sequentially. So whether robot will have a better outcome in this patient, which will show a very good functional outcome in this kind of patient, giving a good, alignment, function, and restoration of the activity of this patient. So finally, to conclude, please go through my editorial in the special issue on arthroplasty in India Journal of Orthopedics in the changing paradigms of arthroplasty practice. March of robots in total joint arthroplasty, we cannot ignore that at present. Robot-assisted surgery increased precision and definitely the component alignment without the surgeons being losing control of the surgery. So surgeon has a control definitely over the surgery. The consistency of the surgical procedure has improved and need for large instrument trays are eliminated from our gadgets. Robots are definitely expensive and have got a large footprint in the operating room. Eventual benefits in terms of patient-related outcome is still to be studied. There is not enough of data in the literature at present. Robots and artificial intelligence-assisted devices will be definitely part of our armamentarium. We need to change with times and use these technologies to the best of our ability, at least at present from my status, I have to see and we have to enhance our techniques and outcomes. But we must not go away from the basics of fundamental principles of arthroplasty which has been taught by masters, not only in our practice, but also in the teachings we impart to our students. My mentors, what Dr. Dholakia said, that everything new may not be better. Even Dr. Bikram sir told you that his experience with the Kinemax Plus knees. And Dr. Ranawat, that if something is good, it will definitely prevail and be adopted by larger population, else it will perish in future. I thank you for a patient hearing.